Hi, I'm Ken Paulus. I'm the founder of Pelvic Wave. We're really excited to partner with Ortho Advantage here in Dayton, Ohio. We brought Pelvic Wave, which is the world's most advanced incontinence system. We actually resolve incontinence in over 8,000 patients in the last several years. What we use here is a high-powered bioelectric magnet to non-invasively reinvigorate and bring control back to the pelvic floor musculature without any needles, without any pads, without any implantable devices, and we can resolve those issues usually within 2 months. What I want to do is I want to talk a little bit about the state of incontinence, what is actually incontinence in women, and I also want to talk about the dysfunction that occurs and what causes these symptoms. And then we're going to talk a little bit about what Pelvic Wave does and how we resolve those. So there's really 3 types of incontinence that most women face. You have what's called stress incontinence, which is also known as bladder leakage. So when you sneeze, laugh, cough, work out, you'll get leakage in your pants, in your underwear, and it'll kind of come on suddenly or after an event. Overactive bladder is just what it sounds like. It's the persistency of going to the bathroom often, and this could be in the middle of the night, this could be at work. And then urgency incontinence is an issue where once you feel the sensation to go to the bathroom, you have to immediately be in the bathroom where you feel like you're gonna lose it and pee your pants. So those are 3 things that we address with Pelvic Wave. Stress incontinence is caused through a weakening of the pelvic floor. So the pelvic floor musculature basically gets weak, and your urethra is a sphincter. And as that muscle recedes or atrophies, that sphincter sits open. So now when you sneeze, laugh, or cough, urine goes down the tube, and if your spigot's open, you leak. That's stress incontinence. Overactive bladder is a function where the bladder muscles don't actively squeeze. They don't squeeze the bladder, and therefore urine is retained in the bladder. And so you may go to the bathroom and your brain says, oh, I've gone. But in reality, if we do an ultrasound, you may have 50, 60, 70, 90% of the urine retained in that bladder. So the symptom of that is a constant going to the bathroom all the time. Urgency is very closely related to overactive bladder, where again, the gas gauge in your brain is effectively been disrupted about what your proper bladder function ought to be. And so it never tells you that you're really full. It only tells you at the very, very last second that you're full, and the weakened pelvic floor muscles don't have time to hold that urine in, so you have to immediately go to the bathroom. So those are the 3 types of incontinence in women that we resolve. All right, to learn more about Pelvic Wave, you can visit pelvicwave.com, or you can check out orthoadvantage.com. There's some great materials online. You can learn about these conditions and what we help resolve. At the end of the day, Pelvic Wave is a very true and tested technology. We've got over 40 clinical studies that back the science. We hope to resolve incontinence in over 8,000 patients in the last 9 years. And so it's just a great tool. Nothing's touching you. You're treated with your clothes on. It's non-invasive. There's no probes. There's no wires. There's no needles. You simply sit in the chair. Usually 24 treatments over 8 weeks, and we've got an 85% success rate. You can check out the clinic. You can get a free demo. Contact us anytime, and we'll be happy to give you some more information.